Welcome to another episode from the Veterinary Research Channel. In today's episode, we delve into a fascinating study exploring the effects of a common pain medication, phenylbutazone, on insulin secretion in horses, particularly those with a condition known as insulin dysregulation. This research, published in the Journal of Veterinary Internal Medicine in 2024, sheds new light on how this drug might impact glucose and insulin dynamics in these animals, potentially offering insights beyond its well-established pain-relieving properties. Laminitis, a painful and debilitating condition affecting the hooves of horses, is often linked to elevated levels of circulating insulin, a condition now specifically termed hyperinsulinemia-associated laminitis. To manage the severe pain associated with this disease, veterinarians frequently prescribe phenylbutazone. Phenylbutazone belongs to a class of drugs called nonsteroidal anti-inflammatory drugs, often abbreviated as NSAIDs. These medications work by inhibiting enzymes known as cyclooxygenase 1 and 2, which in turn reduces the production of prostaglandins, substances that play roles in both normal bodily functions and inflammation. Interestingly, in human medicine, studies have shown that nonsteroidal anti-inflammatory drugs can actually increase insulin secretion and the activity of the pancreas in individuals with diabetes. Given this observation in humans and the important metabolic differences that exist between type 2 diabetes in people and hyperinsulinemia in horses, it becomes crucial to understand if phenylbutazone has a similar effect on insulin secretion in our equine patients, especially those receiving it for the pain of hyperinsulinemia-associated laminitis. Therefore, the researchers in this study set out to investigate the effect of phenylbutazone administration on insulin secretion in horses, with a specific focus on horses diagnosed with insulin dysregulation, often abbreviated as ID. Their primary hypothesis was that phenylbutazone would indeed increase insulin secretion in these horses in response to a standard test called an oral glucose test, often abbreviated as OGT. Furthermore, they speculated that this effect might be more pronounced in horses already suffering from insulin dysregulation. To conduct their investigation, the researchers employed a carefully designed study involving 16 light breed horses. This group included 7 horses that had been previously diagnosed with insulin dysregulation and 9 horses that served as a control group, meaning they did not have this condition. The study utilized a randomized crossover design, where each horse received 2 different treatments in separate periods. For 9 days, the horses were either given phenylbutazone intravenously at a dose of 4.4 milligrams per kilogram of body weight once daily, or they received a placebo, which was a simple saline solution. After a 10-day washout period to ensure any effects of the first treatment had dissipated, the horses received the alternative treatment. On the 9th day of each treatment period, all horses underwent an oral glucose test. This test involves administering a specific amount of glucose, a type of sugar, orally, and then taking repeated blood samples over several hours to measure the levels of glucose and insulin in the bloodstream. The horses were fasted before the test to ensure accurate results. The researchers then compared the insulin and glucose responses between the horses with insulin dysregulation and the control horses, and also compared the responses within each group when they received phenylbutazone versus the placebo. They used sophisticated statistical methods to determine if any observed differences were significant. The results of this study yielded some unexpected findings, particularly in the horses with insulin dysregulation. Contrary to the initial hypothesis and observations in diabetic humans, the researchers found that phenylbutazone treatment significantly decreased both glucose and insulin concentrations in response to the oral glucose test in horses with insulin dysregulation. Specifically, they observed a significant reduction in the overall glucose levels, as measured by the glucose area under the curve, and a significant decrease in the overall insulin levels, measured by the insulin area under the curve, during the oral glucose test when the horses with insulin dysregulation were treated with phenylbutazone compared to when they received the placebo. This significant reduction in both glucose and insulin was particularly evident during the initial diagnostic period of the oral glucose test, which typically lasts for the first 2 hours. Furthermore, the peak glucose concentration reached during the oral glucose test was also significantly lower in the insulin dysregulation group when they were receiving phenylbutazone. Interestingly, no such significant effects of phenylbutazone on glucose or insulin concentrations were detected in the control horses that did not have insulin dysregulation. This suggests that the action of phenylbutazone on glucose and insulin metabolism might be specific to horses with this particular condition. The researchers also confirmed that the plasma concentrations of phenylbutazone in the treated horses were within the expected therapeutic range, and there was no significant difference in these concentrations between the control horses and those with insulin dysregulation. These findings led the researchers to conclude that, in horses with insulin dysregulation, phenylbutazone administration actually decreases glucose and insulin concentrations in response to an oral glucose test. This was a surprising result that challenged their initial hypothesis, which was based on observations in human diabetic patients. The researchers noted that this novel finding warrants further investigation into the potential therapeutic role of phenylbutazone in managing hyperinsulinemia-associated laminitis, extending beyond its traditional use as an analgesic or pain reliever. In their discussion of these results, the researchers acknowledged that their findings differed from previous studies that examined the effect of phenylbutazone on glucose tolerance and insulin secretion in healthy horses. That earlier study, using an intravenous glucose tolerance test, found a decrease in baseline glucose levels, but no other significant changes in insulin and glucose dynamics after phenylbutazone treatment in healthy horses. The current studies focus on horses with insulin dysregulation, a condition involving complex mechanisms of both increased insulin production and reduced insulin sensitivity, could explain these discrepancies. The researchers also considered findings from studies in humans with type 2 diabetes and in animal models of diabetes. Some of this research suggested that nonsteroidal anti-inflammatory drugs could increase insulin secretion by acting directly on the insulin-producing beta cells in the pancreas. However, the results of the current study in horses with insulin dysregulation showed the opposite effect, a decrease in insulin secretion in response to phenylbutazone. This highlights the important metabolic differences between these conditions in different species. One potential explanation for the observed decrease in glucose levels in the horses with insulin dysregulation treated with phenylbutazone could involve the gastrointestinal peptide glucagon-like peptide 2, often abbreviated as GLP-2. This peptide has been shown to have effects on the intestines, potentially increasing glucose absorption, and has been reported to be elevated in ponies with insulin dysregulation. The researchers speculated that phenylbutazone might influence the GLP-2 pathway, leading to decreased glucose concentrations in horses with insulin dysregulation, a possibility that requires further research. Another avenue of thought involved incretins, such as glucagon-like peptide 1 and glucose-dependent insulinotropic polypeptide, which are hormones that stimulate insulin secretion in response to food intake. Prostaglandin E2, the production of which is inhibited by phenylbutazone, is known to have an inhibitory effect on incretins. The researchers initially hypothesized that inhibiting prostaglandin E2 with phenylbutazone would lead to increased insulin, mediated by increased incretin activity. However, their findings showed a decrease in insulin, suggesting a more intricate relationship between prostaglandin E2, incretins, and insulin secretion in this context. Interestingly, a study in mice with diet-induced type 2 diabetes showed that treatment with a nonsteroidal anti-inflammatory drug led to a decrease in both prostaglandin E2 and insulin and glucose concentrations, similar to the findings in this equine study. The researchers also considered the role of inflammation and insulin resistance, both of which are components of insulin dysregulation in horses and are also linked to obesity and diabetes in humans. Some studies in animal models have shown that anti-inflammatory treatments can improve glucose tolerance and insulin sensitivity. Therefore, it is possible that phenylbutazone, by reducing low-grade inflammation associated with insulin dysregulation, might improve insulin sensitivity, leading to decreased glucose levels as the body becomes more efficient at glucose uptake and, consequently, lower insulin secretion. The researchers acknowledged several limitations to their study. The number of horses involved was relatively small, with only 7 horses in the insulin dysregulation group and 9 in the control group, which means caution should be taken when generalizing these findings to a larger population. Additionally, there was some variability in breed, age, sex, and initial insulin responses within the groups, although the researchers argued that this might better reflect real-world clinical scenarios. The study was also conducted in horses that did not have active laminitis. It is possible that the presence of inflammatory mediators in horses with acute hyperinsulinemia-associated laminitis could alter how phenylbutazone affects glucose and insulin dynamics. Measuring these inflammatory markers could have provided further insights, but was beyond the scope of this particular study. Finally, while plasma phenylbutazone concentrations were measured to ensure adequate drug levels, the researchers noted that ideally, prostaglandin E2 concentrations would have also been quantified, but this proved technically challenging. Despite these limitations, this study provides valuable new information about the effects of phenylbutazone in horses with insulin dysregulation. The finding that phenylbutazone decreases glucose and insulin responses to an oral glucose test in these horses suggests a potential mechanism beyond simple pain relief. This mechanism could involve modulation of incretin secretion, leading to reduced glucose uptake and insulin secretion, or an improvement in insulin sensitivity due to the drug's anti-inflammatory properties. The researchers emphasized that while long-term use of non-steroidal anti-inflammatory drugs is generally not recommended due to potential side effects, short-term use in this context did not appear detrimental in their study. They concluded by highlighting the need for further research to fully understand the mechanism of action of phenylbutazone on glucose and insulin dynamics in horses with insulin dysregulation, as this could open up new avenues for therapeutic interventions in this challenging condition. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.